Hello, in today's video, we'll dive into an essential aspect of medical coding modifiers. Whether you are a seasoned coder or just starting out, understanding modifiers is crucial for accurate coding and reimbursement. So, let's get started. First thing first, what exactly are modifiers in medical coding? Modifiers are two character codes that provides additional information about a procedure or service. They help clarify aspects like location, number of services, or specific circumstances that might alter the standard process. They don't change the definition of the procedure but rather give more context to it. Think of modifiers like add-ons to a movie ticket. They tell you whether you are watching in 3D, IMAX, or a standard version. Just as those details affect your movie experiences, modifiers impact how a service is interpreted for billing. Modifiers are crucial because they ensure accurate billing and prevent calm denials. For instance, if a doctor performs multiple procedures on the same day using correct modifiers can mean the difference between full payment and a rejected claim. It's all about providing payers with the right context for a service provided. So, why should we care about getting the modifiers right? Because incorrect modifiers can lead to underpayment or even overpayment, both of which can cause issue for healthcare providers and patients alike. Now let's talk about some of the most commonly used modifiers you'll encounter in medical coding. First is modifier 25. This is used when a separate significant identifier evaluation and management service is performed by the same physician on the same day as another procedure. For example, if a doctor evaluates a patient's condition and then perform a minor surgery, this modifier would be added to the EM code. Second is modifier 59. This indicates that two procedures that are usually not reported together are indeed separate in this case. Think of it as saying, yes, I know these services are related, but they were performed independently. Third is modifier 50. Use this for bilateral procedures. Procedures performed on both sides of the body in the same sessions. Fourth is modifier 76. This is used when a procedure or service is repeated by the same physician on the same day. It prevents claims from being rejected due to perceived duplication. Now that we have covered some of the common modifiers, let's explore when and how to use them correctly to avoid common mistakes. When using modifiers, it's important to follow the specific guidelines provided by the payer. Here are some key tips. First is always double check the payer's rules. Some modifiers might be accepted by one insurance company but not by another. Second is use modifier 59 cautiously. It's often misused if other more specific modifiers apply, use those instead. Third is documentation is crucial. Make sure that medical records justifies the use of modifier to avoid audits or claim denials. It can be a bit tricky at first, but with practice you will be able to identify when and how to apply modifiers like a pro. Now let's take a quick look at how modifiers impact reimbursements. Modifiers plays a significant role in how much a healthcare provider gets reimbursed. For example, a procedure without a modifier might be paid less because the payer assumes it was part of another service. Adding the correct modifiers ensures that all provided services are fully recognized and compensated for. Incorrectly applying a modifier, however, can delay payment or result in an audit. That's why coders must stay updated with guidelines and best practices. Before we wrap up, let's address some common questions and misconceptions about modifiers. One common misconception is that adding a modifier guarantee payment. Remember, it's about proper usage and supporting documentation. About frequent question is about using multiple modifiers. Yes, it's possible, but you have to follow the correct order. Always list the most relevant modifiers first. And that's a wrap. I hope this video has helped you understand that importance of modifiers in medical coding. If you found this content useful, don't forget to like, share and subscribe for more insight into medical coding. See you in the next video.